Hi, this is Bob Finberg, Lancaster Insurance Services. I want to talk this morning about health insurance exchanges, which is part of the Affordable Care Act. Health insurance exchanges are an alternate market for both individuals and businesses to purchase medical insurance, health insurance. In the state of California, our state has already set up exchanges. Some states have yet to set them up, and some states have the option of participating in a federal exchange very similar to the way Medicare works. California's exchanges are going to be the exact same product as the non-exchange product. So it's not going to be shopping for products so much as it's going to be shopping for the one that works best for you, either in or out of an exchange. The exchanges are going to be designed so that if somebody has income issues, some level of poverty, then they're going to be subsidized within the exchange. The interesting thing that I learned from Anthem Blue Cross is I met with their regional manager, whom I've known for over 20 years. He's a very reliable individual, and he was educating me personally on the exchanges. He said, what's going to happen in January of 2014, when the exchanges become operative and real, is that the plans that the insurance companies are going to offer, and we'll speak specifically about Anthem at this moment, those plans that they're going to be offered are going to be just like they're going to be like Olympic gold medal. They're going to be like Olympic medals. There's going to be a bronze plan, there's going to be a silver plan, there's going to be a gold plan, and there's going to be a platinum plan. Those plans are identical inside the exchange as outside the exchange. They're absolutely identical. So all the plans that are out there right now, let's say that Anthem is offering 20 different plans, perhaps it's 17, 18, it doesn't matter. We're going to get down to those few, and you'll buy you'll buy the product that you can afford, that you can do the best with, which is pretty much what people are doing today. You can get what we used to call a Cadillac plan and pay an awful lot of money for it, or you could get a more stripped down plan, maybe a Volkswagen, and it wouldn't have quite as much coverage. It might have a high deductible. It might have high copays. On the Cadillac type plans, it might have low deductibles and low copays, or it might be an HMO. So what's interesting here is that the exchanges are going to be reality in just a little bit more than 6 months. Every day I get literally dozens of emails from different marketing organizations talking about healthcare exchanges and what are we going to do as agents to help our clients and everyone else with their questions about medical insurance, about the exchanges, and about health insurance. To start with, know that these plans that are going to come out in the exchanges are going to be the same in and out of the exchanges. You'll still be able to pick the level of coverage that's affordable to you. If you have income issues, then you'll be able to enter the exchange, get the exact same plan you want, and if your income withholds, then you'll be subsidized to a certain degree. I asked him if Anthem, who by the way is one of, if not the largest medical insurance provider in our country, I asked him if Anthem was concerned about the exchanges and concerned about the levels of subsidy, and he said they really aren't that concerned. He said when it comes down to the exchanges, the number of people that will be in the exchange and picking a platinum plan will probably be non-existent, because it doesn't make sense. They're not going to go into the exchange to pay a lot more money out of pocket just in order to get the subsidy. So they may wind up with that silver plan, or they might wind up with a bronze plan. That's sort of what I'm seeing right now. At this very moment, I cannot say exactly what those copays and deductibles will be on those different colored plans, but what I can say is that you can rely on me, my agency, Lancaster Insurance Services, to help you get through this, to answer your questions. As a matter of fact, we invite you to call us, 661-726-1337, or email me, Bob Finberg. giving you a wrong email address. Bob at lancasterinsurance.biz or Bob at lancasterinsuranceservices.com. Give us a call. We'd be glad to talk to you about it. We'll be glad to meet with you, talk about the exchanges whenever you're ready.